Welcome back. You're watching Times Now. Well, amid a spike in COVID cases over the past 1 week, the centre has issued a fresh advisory to 6 of the states that have been recording the highest number of cases in this spike. In fact, the state of Maharashtra has witnessed a spike of 188% in its weekly caseload, but the positivity rate still remains below 2%. Well, the state of Gujarat has seen a spike of 265% in the cases in the last 1 week, and Telangana has seen a weekly spike of 202%. However, the situation is still well under control, with all these states reporting a positivity rate of under 3%. Well, the centre has urged states to closely monitor new and emerging clusters and genome sequencing to be conducted for all the international passengers. The states have also been recommended to increase awareness of precaution doses as well as enforce COVID protocol in crowded areas. So how are the states stepping up their guards? Let's find out.
A recent surge in the number of COVID patients, especially in the 6 states which have been highlighted, but in Delhi per se there are a small number of increase in cases as compared to what they were till a couple of weeks ago. So we just have to put our guard back, and we need to be careful, as been highlighted by the government advisory. So it's always better to be cautious than to be sorry later. At the same point, we don't need to panic, because what we've seen is it's not that complicated and not that severe form of COVID, but yes, it's always good to be on guard.
Well, let me go across to Dr Sanjeev Bagai, chairperson of the Nephron. Also joining us on the show, Dr Vikas Maurya, the director and HOD of pulmonology in Fortis Hospital of Shalimar Bagh. Let me come across first to you, Dr Bagai. You must explain to us, many people have been very worried if they have fever. Is it COVID or is it influenza? Because that's also in this thing. What is it that we should be looking out for? Because honestly speaking, the symptoms are very confusing, very similar in both.
Good afternoon. I think this is the most pertinent clinical addressal to be made. So all viral fevers for the first 48 to 72 hours by and large will appear with the same signs and symptoms, which will include fever, a little bit of headache, body ache. If you have COVID, the incubation period is slightly longer. If you have what we call as influenza H3N2, or any other variant of influenza, the incubation period is approximately 1 or 2 days, so it's shorter. COVID lasts much longer. It can go up to weeks, it can go up to months, whereas influenza is self-limiting between 5 and 7 days. There is almost a natural and spontaneous recovery. It's a transient infection and there is no immediate cause to worry or panic. The classical symptoms which differentiate COVID versus influenza is that COVID, at least in the Delta variant, had loss of smell and taste, not so much in Omicron. But Omicron per se will have more amount of rashes and gastrointestinal symptoms, whereas the influenza will normally have a sore throat, cold, cough. It's also important to differentiate influenza versus seasonal allergies, which will have more of just sneezing and runny nose. So I think in the first 48 to 72 hours, it's close observation. The patients, if they have any symptoms of fever or any other respiratory symptoms, should wear a mask and isolate. Do not rush into extensive testing in the first 1 or 2 days, and no irrational and overuse of antibiotics.
And that's very important. Even the Union Ministry has said, do not self-medicate, do not start taking antibiotics. That could be very, very dangerous. So, Dr Vikas Maurya, what should a person do? Can we do anything to keep ourselves safe, get ourselves vaccinated?
Yes, it's very, very important, as we know that the whole world is suffering from, the one or other respiratory viruses. I think for last 3 years, the COVID is causing its impact. And, the thing is that it's very important people to keep their, immunity, stronger. Those people who are, elderly, those who are at high risk, I think they should keep their guard. I think they should get vaccinated. And also, obviously, they should avoid, going to the crowd places. Even if they want to, then obviously they should wear the mask. This is I'm saying for those risk group which are very at high risk group. Those who are prone for severe form of the disease if they acquire the infections. But yes, predominantly at what we are seeing is that is basically influenza, which is a milder form of the disease, and which which at the moment is not causing so much of the problem, and therefore we should not be, worried regarding the influenza point of view. But yes, we should not lower the guard as well, because at the moment we are seeing that some cases of COVID are also, coming at the moment. But so far, they are all very mild cases, so we should not, panic about. But yes, we should continue to take the precautions. As said, that yes, we should, the hand hygiene very important, obviously. And yes, we should not, we should be this is very important for, the high risk group of individuals. And yes, we should wear the mask as well, so that we can prevent ourselves from these, infections.
Absolutely.
And those who get infected, they should get isolated as well.
And that's very good advice coming in, that don't press the panic button. However, you must take precautions. Thank you so much, Dr. Maurya, Dr. Bagai, for breaking it down for our viewers.